Kim, what's on your radar?
Alongside the thousands of working class who have resisted vaccine mandates, we're now beginning to see a string of high-profile resignations and refusals as well. People willing to give up millions of dollars. And we've heard about the thousands of employees in a variety of sectors unwilling to adhere to the mandates: hospitals, care facilities, police and fire departments, restaurants, hotels, and airlines are amongst the many industries under increased strain from workers protesting. But now we're starting to hear about the high-profile people resisting and threatening their jobs as well. 2 days ago, popular conservative radio and television talk show host Dan Bongino announced live on air to his radio syndicator Cumulus that he will quit over the mandates.
Imagine the countless number of individuals trying to explain to these companies. Ever thought of that? The countless numbers of moms and dads who are sitting at some kitchen table explaining to their kids how they may have to move out, how daddy doesn't have a job, because a bunch of people in a C-suite thought it'd be a good idea to sit around and play pretend Dr. Fauci for a moment and mandate people jam something in their bodies that they don't want to take. You ever put yourself in that role? You ever put yourself at that kitchen table with mom and dad telling their kids that? Imagine how the kids respond, that fear they got to live with. You know, I grew up without a lot of money. My mom used to make bologna sandwiches for dinner. And when the bologna was no good, you'd cook it and you'd make it good right quick, right? I'm not leaving any of those guys behind. You can have me or you can have the mandate. But you can't have both of us.
Now, Dan Bongino is himself fully vaccinated. He has been battling cancer and is currently in remission. However, he ideologically opposes mandates and is willing to give up his partnership with Cumulus if they choose to threaten people with injections in order to keep their jobs. Bongino also works for Fox News, which has a vaccine mandate with a test option for its unvaccinated employees, and seems to be okay with that. But he's willing to risk his radio show, which is very popular and heard in over 300 cities. His contract is no doubt worth millions of dollars, and that's a lot of money to walk away from. Washington State University's head football coach and 4 assistant coaches were fired yesterday for not complying with their state's vaccine mandate. The head coach, Nick Rolovich, is walking away from a $3.2 million annual salary. The world's #1 men's tennis player, Novak Djokovic, will likely miss the Australian Open, a Grand Slam tournament of which he is the reigning champion over his refusal to reveal his vaccination status. Djokovic is risking his ranking and sponsors worth millions of dollars by refusing to comply. Also, NBA player Kyrie Irving, the Nets superstar point guard, will be sitting out this season over his refusal to be vaccinated. This decision could cost him his whopping $186 million contract. Now, I'm sure this isn't the last of the high-profile resignations we'll be hearing about over the next couple of months as vaccine mandates come closer to their enforcement dates. The idea behind the mandates is to make workplaces safer by preventing transmission. This is why Biden has tasked OSHA with enforcing his federal vaccine mandate laws. But many people wonder if their employer would be liable for any adverse reactions after requiring the vaccine as a condition of employment. On OSHA's website, under frequently asked questions, when asked whether or not adverse reactions to the vaccine are recordable on the OSHA's record-keeping log, the published answer says this, quote, "The Department of Labor and OSHA, as well as other federal agencies, are working diligently to encourage COVID-19 vaccinations. OSHA does not wish to have any appearance of discouraging workers from receiving COVID-19 vaccination and also does not wish to disincentivize employers' vaccination efforts. As a result, OSHA will not enforce recording requirements to require any employers to record workers' side effects from COVID-19 vaccination, at least through May 2022. We will reevaluate the agency's position at that time to determine the best course of action moving forward." Now, this is a change to OSHA's previously published enforcement guidance, which required employers to record adverse events for required COVID vaccinations, not for recommended ones, to ensure workers retain the right to file workers' comp claims. However, now that OSHA is removing the recording requirement from their guidelines, it's unclear at the moment whether or not employees could seek damages. But let's move on to the reason for the mandates to prevent transmission. Now, according to the New York Times, the 5 top states with the current highest rates of increased transmission are Connecticut, New Mexico, Vermont, Massachusetts, and Rhode Island. Also, according to the New York Times, these 5 states are heavily vaccinated. 4 of which are in the top 5 most vaccinated states in the country, with New Mexico in the top 10. Research conducted by a Harvard professor titled, quote, "Increases in COVID-19 are unrelated to levels of vaccination across 68 countries and 2,947 counties in the United States," unquote, was recently published in the European Journal of Epidemiology. The paper concluded that there was no correlation between vaccination rates and community spread of the virus. Though it was originally reported that vaccines would prevent you from getting COVID, what they have shifted to saying now is that vaccines help reduce your chances of having a severe outcome. So if you want to reduce your risk of ending up in the hospital or dying from COVID, the vaccine is one of your best shots at risk reduction, pun intended. But all of this data seriously and the wave of protests and resignations calls into question the need to continue to double down on highly divisive mandatory vaccinations, which are causing a ripple effect of harm to our economy and to our community. One thing I also want to point out is that with all of these mandates, when you're looking around the world, it'd be one thing if they continued to double down on the mandates as more data came out showing that the vaccines were in fact safer and safer. We're getting this body of evidence coming in. But instead, we're seeing some concerning trends. Like in Scandinavia, they have now limited the use of Moderna or banned the use of Moderna altogether. Iceland, I believe, banned it altogether, but the other Scandinavian countries, the other 4, have limited its use for people under 30 or in some cases under 18. And they've also banned Johnson & Johnson's vaccine for anyone under the age of 65. And so, when you're looking at these mandates and saying you've got to take this or you can't have a job, and then people are kind of reading the news and they're saying, well, but the spread, it's not stopping the spread, it seems. Yeah. It's, they're banning it in certain, they're questioning the safety profile in certain other highly advanced countries. Like, I don't know. I think there's a lot there to kind of call into question. But it's interesting now that these really high-profile people are saying, I'm willing to walk from millions. Yeah, I'm as against the mandates as you are. I'm very pro-vaccination, but absolutely against the mandates. I think it's important to keep in mind, though, like when people like Bongino say, they're almost making it sound like their employers are doing this to them, but there's like Biden released a federal mandate. It's really like the government is making your employer make you get vaccinated. That's the part of it that I'm opposed to and that I think is totally wrong, but it's not. So I'm not sure if I would people who are resigning in protest. I mean, but it's not the employer's fault. Like, it sucks for them that they have to make their employees do this, but the federal government is telling them that they have to do that. Yeah, I'm curious about that, though, because when I looked at the other radio companies, for example, Odyssey, which I used to work for, they're not actually requiring their current employees to get vaccinations. They are requiring new employees. And iHeart has no actual policy, or it seems to be in discussion of policy. There's nothing floating around about iHeart with that. So, I'm curious how that mandate is even working out on the federal side and how it's impacting employers. Maybe they're going to wait it out until it's struck down by the court eventually. But I mean, some companies are doing it on their own. Fox had as we broke here on Rising, Fox had a vaccine mandate before the federal government did. But with some exceptions that the federal government is not. They've narrowed those. Yeah. They've narrowed those since then. I feel like a radio host, if they've got their own door and they're going right into a studio and they're not interacting with anybody, who cares? Bongino strikes me as a ridiculous hypocrite. He's one of these hosts that took the vaccine himself, but is encouraging his people not to. At least a bunch of these other right-wing radio hosts who have been anti-vaccination have themselves not gotten vaccinated. It's tragic that so many of them have died. The only thing I would add to this, and there's people are dug in on this, and there's not a whole lot of point in going around and around, but I would say that you're 6 or 7 times less likely to get infected if you take the vaccine. That's commonly accepted at this point. There could be a new variant that comes in and wildly breaks through the vaccine. We don't know that yet. But currently, if you're 6 or 7 times less likely to get infected, then you are just obviously, as a logical matter, less likely to pass it on. You can't pass on what you don't have. So I would just make that point. Right. People can do with it whatever they want. And trying to prevent severe disease is worthy on its own, right?
We don't know. If it's the case that everyone is eventually going to get COVID, for the overwhelming majority of people, for everyone except possibly very young children, you're going to wish you had the vaccine if you get COVID. So why not do it? Even if we're not, even if it's not holding up, stopping transmission against the more transmissible Delta variant or an even more transmissible variant down the road.
Which at this point, the Delta variant is the only variant that is being really, right. I mean, the Alpha and the Beta are no longer really being circulated, which is where the transmission, it seems to prevent transmission of those. I mean, I don't see the data yet showing, I mean, there's always the clinical trial data where they say, well, it works in this way in the clinical trial, but then in the real world, we're seeing a completely different outcome. And I think for, many of us, we can see with our own eyes the trends of it's not really stopping community spread. Maybe it slows it slightly. I mean, we don't know. The data is still really unclear. It does clearly help prevent you from getting, for some people, not everybody, but, it reduces your risk of hospitalization and death. And that is something to take in consideration if you are a high-risk person.
And I posted this chart on Twitter. The numbers are what they are, and it's not just hospitalizations and deaths. The case count for unvaccinated people, skyrocketed in June or July to 6 or 7 times ahead of the vaccinated. And so the people most likely of the vaccinated to get it were Johnson & Johnson, which is what I have coursing through my veins. Below that was Pfizer. Below that was Moderna.
And maybe you'll be able to get a booster shot of one of the other. We can all mix and match. They
haven't banned it here yet, so I'm going to get my cocktail.
Looking forward to that. Yeah, we'll have more Rising after this. Please stay with us.